This video shows the technique for making a Riboond fiber reinforced periodontal splint. Riboond first became popular as a material for making periodontal splints, and it is still recognized as the industry standard for this application. These splints are easy to make, strong, aesthetic, and exceptionally durable. Please note that this video is intended to provide an overview of the procedure and that it is not intended to be used in lieu of the instructions that are included with the Riboond kit. For periodontally mobile teeth, it will make the procedure easier if we stabilize the teeth using a polyvinyl siloxane impression material in the gingival embrasures. This will also prevent composite from intruding into these spaces and will make cleanup easier. Measure the area where the Riboond will be placed using the dead soft tinfoil provided in the Riboond kit. Wax dental floss can also be used as well. Then cut the Riboond to the corresponding length. A small amount of tacky viscosity composite can be used on every other tooth to help hold the template in position. Adapt the tinfoil or dental floss to the teeth as you would adapt the Riboond. Cut or mark the end of the template to indicate the length that will be needed to cut the Riboond. You may want to err on the side of cutting too much rather than cutting too little, as you can trim the excess Riboond before curing with the special Riboond scissors. Cut open the plastic packaging and use cotton pliers to extract the Riboond. Cut the Riboond with the special Riboond scissors. Riboond is made from the same ultra-high molecular weight polyethylene fibers used to make bulletproof vests, and normal scissors will not cut it cleanly. Reseal the Riboond by folding over the end of the packaging and securing it with the paperclip. This will help to maintain Riboond's indefinite shelf life. Clean the teeth and prepare the teeth for bonding. Clean, acid etch the teeth, and apply the bonding adhesive using your standard bonding technique and materials. Please note, since there is no clinical evidence supporting the use of self-etching resins for this type of retentive bonding, we do not recommend using self-etching resins for this procedure. Apply a thin layer of a soft filled composite to the teeth. We don't recommend using a flowable composite for this step because flowables tend to lack the tackiness to hold the Riboond in position prior to curing. Riboond Incorporated has a specially formulated filled composite resin designed for bonding the Riboond to the teeth. It has a viscosity that is between a flowable composite and a filled restorative composite. This video shows the technique using the Riboond securing composite. If you do not have the Riboond securing composite, we have a list of some of the composite resins from major manufacturers that we recommend for this step on our website. If using a paste viscosity composite, place a thin bead of composite on the teeth, and then with an instrument, flatten it to mimic the contours of the teeth. Flattening the composite will make the adaptation easier and reduce the amount of composite that needs to be displaced when placing the Riboond. Try to make this layer approximately 0.5 millimeter thick. Whether you use the Riboond securing composite or a paste viscosity composite, make sure that the composite is placed in a continuous bead. It is important that the composite is placed within the interproximal contacts. Do not cure yet. Wet the Riboond with a 4th generation unfilled adhesive bonding resin. After the Riboond is wetted with the bonding resin, you can now touch it with your fingers or powder-free latex gloves. Do not wet the Riboond with a bonding resin that contains a Dentin primer or a self-etching component. If you do not have a suitable resin already in your office, Riboond Incorporated offers the Riboond wetting resin, which is a standard 4th generation unfilled bonding resin. Starting at one end of the periodontal splint, press the Riboond into the composite resin that was previously applied to the teeth. You can use your fingers or an instrument to press it through the composite. Starting at one end, press the Riboond into the composite resin that was previously applied to the teeth. Use your fingers or instruments to press it through the composite closely against the tooth surface. Remember, the thinner the bond line is, the better the results, so try to displace as much composite as possible. This will not only minimize bulk and aid in patient comfort, but it will also maximize the laminate effect. For periodontal splints, cracks begin at the contacts. Therefore, try to adapt the Riboond as deep within the interproximal contacts as possible. Like packing retraction cord, adapt the Riboond from the free unadapted end. Hold the adapted section of the Riboond against the surface of the tooth and use a thin-tipped instrument to tuck the Riboond deep into the interproximal contact. While still holding the adapted Riboond with your finger or an instrument, gently adapt the Riboond against the lingual surface of the next tooth. Hold the Riboond against the tooth with your finger and using a thin-tipped instrument, tuck the Riboond into the next interproximal contact. Riboond has virtually no memory, so it should not spring out of position after placement into the composite. Work your way from tooth to adjacent tooth until you've gone from one end to the other. Riboond's manageability will allow it to easily follow the curvature of the arch and to follow the contours of the teeth. If the Riboond piece is too long, cut the excess with the special Riboond scissors prior to curing. After placement, using the same thin-tipped instrument, carefully remove the excess composite resin that was displaced during the adaptation of the Riboond. Move the instrument parallel to the lengthwise orientation of the Riboond to avoid accidentally displacing the Riboond. Check the final placement of the Riboond, and after the removal of the excess composite, polymerize. For an extra coronal splint, paint a thin layer of flowable composite over the Riboond splint. Shortening the bristles of a microbrush will add more body to the brush. Do not use the Riboond securing composite for this layer. Polymerize each area for 5 seconds, just enough to prevent the composite from slumping. Paint another couple layers of flowable composite onto the splint. Try to make this covering layer as smooth as possible. Riboond fibers do not polish well, and we want to avoid having to shape and polish the splint using rotary instruments. As mentioned previously, Riboond is made of the same fibers used to make bulletproof vests. When you're satisfied with the composite covering layer, polymerize the splint thoroughly.